Journalists online, please.
An explanation coming Thursday from the World Health Organization on why the number of coronavirus cases jumped dramatically by roughly 15,000 overnight in Hubei, the Chinese province at the center of the outbreak, where the death toll saw its biggest one-day spike of more than 240.
And crucially, we understand that most of these cases relate to a period going back over days and weeks and are retrospectively reported as cases since sometimes back to the beginning of the outbreak itself.
But that's not the only reason for the huge increase. It's also being linked to how cases of coronavirus, also known as COVID-19, are being diagnosed. That now includes the use of CT scans in Hubei, a region that remains on virtual lockdown in an effort to stop the spread of the virus.
In Hubei province only, a trained medical professional can now classify a suspected case of COVID-19 as a clinically confirmed case on the basis of chest imaging rather than having to have a laboratory confirmation. This allows clinicians to move and report cases more quickly.
The WHO says the sharp increase in cases out of China does not represent a significant change in the trajectory of the outbreak. And an update from the UN agency on its coronavirus advance team led by Canadian Dr. Bruce Aylward, who's described by the head of the WHO as a veteran of past public health emergencies. Aylward arrived in China earlier this week. The rest of the international team is expected to start arriving in China this weekend. Still ahead, what about coronavirus cases outside of China? Plus, good news for some passengers on that quarantine cruise ship off Japan. The number of coronavirus cases is not increasing dramatically outside of China. That update from the World Health Organization after the recent spike in cases in the Chinese province of Hubei.
Outside China, there are 447 cases from 24 other countries.
A handful of those cases have been confirmed in Canada. As for the largest cluster of cases outside of China, it's at sea off the coast of Japan, where the number of coronavirus or COVID-19 cases is climbing on the Diamond Princess cruise ship. The number of Canadians who've tested positive also rising, and they're among those who've been taken to nearby hospitals for treatment. The Government of Canada launching a web page dedicated to supporting Canadians aboard the Diamond Princess, and it can be found through travel.gc.ca, and it includes emergency embassy contact info. And good news for some of the more than 3,500 people on board that ship. Japanese authorities say some elderly people will be allowed to disembark on Friday before the ship's 2-week quarantine is expected to end next week. Relief on a different cruise ship. The MS Westerdam finally docked in Cambodia after it was barred from 5 countries over coronavirus fears, even though no one had tested positive. More than 200 Canadians were on that ship.
You mentioned the iceberg analogy.
And another update from the WHO confirming Japan's first reported coronavirus death, a woman in her 80s who'd been hospitalized since early February. She's the 3rd confirmed fatality outside of mainland China after deaths in the Philippines and Hong Kong. Also out of Japan, Tokyo's 2020 Summer Games president says his committee is not considering canceling the Olympics over coronavirus. The games are set to begin in July. For City News, I'm Melissa Duggan.